Well, at a time the rest of the world is ramping up their COVID-19 vaccination programs, some countries on the continent are even yet to get their first dose. The inadequacy of vaccination in Africa has been a topic that birthed many schools of thought, as the rich nations of the world are not letting vaccines go for free, while most African countries can't afford to inoculate that population. So far, Africa has only vaccinated just 6%. Yes, you got it right, of its population. Yet the alarm bells are not going up. Why is Africa's vaccination drive low? Inadequacy, disinterest, uninterested, richer nations, or overconfidence from Africans? Welcome to VSA. I'm Sulaiman. Now, Africa has so far recorded 8.65 million cases of COVID-19 and has reported 222,000 fatalities. Now, this stands for 2.56% fatality rate, which is by far the lowest in the world. There are still countries in Africa that are yet to vaccinate their citizens, while many others have jabbed only a few people. Countries like Morocco with 60% full vaccination of its populace, and South Africa, 22% full vaccination. Rwanda, 19% full vaccination are clear exceptions on the continent. While there are impressive ones like Morocco and South Africa, there are the likes of Cameroon with 0.7% full vaccination, DR Congo with 0.5%, and Chad with 0.4%. Now, the rest of the world wonders what Africa is doing that makes it so confident, and what have helped the continent manage one of the worst public health problems ever, and by far the worst in this century. Vaccine nationalization has become a global issue, and the failure to grant African pharmaceutical companies the intellectual property to produce COVID-19 vaccines on the continent is still being discussed. We have public health practitioners and researchers here today to help us unpack all of these issues. Well, right here in the studios is Dr. Adefolarin Opawoye. He's the Infection Prevention and Control Team Lead, Lagos, in Southwest Nigeria for the COVID-19 response team, and Dr. Abiye Hector-Goma, the Clinical Director, Chapeltown Primary Care Network, Leeds in UK, and Dr. Peter Imoesi, a research fellow at the University of Aberdeen in Scotland. Gentlemen, Africa is excited to have all of you with me on the show. Let me start with you, Dr. Imoesi. You had spoken about this quickly before, and somehow we're still here. The numbers are not adding up, but it doesn't look like a dire situation yet. But again, what exactly is happening when we talk about vaccine not really going around, or people still a little bit skeptical? What's that word you call it again?
Hesitance. So thank you for having me this evening. So I think when it comes to vaccine distribution around the world, Africa in this regard, it's based on vaccine nationalism. Like what we see in wealthier nations right now is that you have the US, the UK, Germany going for the booster dose among people who are within the age of 18 and above in the US. So in the US, if you are 18 and above, you're allowed to take the third dose of the COVID-19 vaccine. Whereas in Africa and many other low-income countries, there are many persons who are actually vulnerable, but they are yet to receive just one jab. I think what this really speaks to is that countries like Nigeria, South Africa, or Africa in general need to sit tight when it comes to research and development. And that is let me say, a window for us to know that in the nearest future, once there's an outbreak, it's going to be all man to yourself. If you lack the capacity to develop your own drug or your own vaccines, your people may likely be at risk. So I think it's a welcome development for Africans to wake up to kind of smell the coffee right now.
Okay, let me come back to the studios and Adefolarin with me here. And Adefolarin, we're almost 2 years into COVID-19 in Nigeria, and Lagos has been the epicenter of the virus. Let us in on what some of the key things you've learned so far in terms of the variants and actual devastation of the virus.
Well, I mean, like you said, Lagos has been the epicenter, and that's been a blessing because one of the things that have helped our response to the COVID virus was the experience we had with Ebola in 2014, which also landed in Lagos, So we've actually been able to build capacity, and we've had very strong people in infection prevention and control. For example, we have built capacity in laboratories. We have more than 25 PCR labs in Lagos alone. Those are the private labs.
More than 25?
More than 25. You understand, which has been because of the drive by the government to involve the private sector. Before COVID, we had only 3 labs in Africa that could diagnose something like the virus, you understand? So you can imagine that capacity, you can imagine the capacity development. We've been able to get a lot of experience. Experience is quite invaluable in my field, you understand? And we've been able to have all sorts of equipment and all that, So it's actually been a learning curve, but I think we've adapted pretty well to it.
Before I go to Abiye, Dr. Abiye, quickly, let me throw this into you. How was the Lagos State government or the Nigerian government able to achieve a reduction in the number of daily cases?
Well, it's quite fascinating that COVID has been a bit of a conundrum because our colleagues outside Africa do not understand how we're doing it. They can't explain it. There's a lot of research going on to say, how are you guys turning it down? Why do you have so many few mortalities? Like you said in your intro, we have the fewest mortality in the world. You understand? Unlike so many things, people predicted a lot of devastation. And so let me just say that we can't really explain so much now. There's a lot of research going on. Some people have said maybe it's our exposure to malaria. There's a paper that's going to come out not very soon as far maybe the exposure to malaria gives us some protection. Some people thought, well, maybe the exposure to the BCG vaccine. So despite the fact that we're very sure that, numbers are underreported, but you can't hide bodies. And the reality is that it has not come close to anything that is going on in Europe or the Americas, not at all. We don't know why, but we thank God for it.
Well, I think it's some of the key things Peter had raised once. Let me bring in Dr. Abiye. People are worried, Doctor. Now the Yuletide is around the corner. Just recently, Lagos State cancelled a big party that the state should have held. Tell us what's happening in the UK. I know in some parts of Europe, specifically in Austria, they seem to have brought back, or shut down. So let us in on what the virus is doing in the UK.
There is kind of disquiet because we seem to be doing the same thing we've done the first wave, the second wave. A few scientists, a few people are keen for the government to, restrict activities to try and begin to force people to do things they don't want to do. But the government and some of its advisors are saying we are not there yet. So while in Europe, like you mentioned, in Austria and in the Netherlands, there is quite some concern. But in the United Kingdom, the government is saying we're in control, so do the right thing, face mask and all the sanitation and stuff, but we're not going to shut down things. And the first wave, second wave, the same thing happened. People felt that government was 1 week behind or 2 weeks behind when they should have intervened. But so far, life continues. People are going about their normal lives.
Well, Dr. Abiye, let me stay with you. Once we had this robust conversation that went on for almost a month with Dr. Imoesi and some other, African experts about primary health care, especially in many African countries. Let us in on what we can learn from improving expertise, in that area, especially in the area of vaccination.
I think it's a big, as you can imagine, you have to have institutions, You have to have institutions in health, in governance, transparency, having technocrats, the right people in the right places. And that's why when pandemic at this nature arises, you are going to depend on established institutions. So whatever achievements there are, everything comes back down to the system of the level of development, how things work, communication, how people are paid. What goes on in the everyday life of a country is what determines the success of programs such as this. Africa has a very fragile health system. And because we have a very fragile health system, maybe the scientists will let us know why we have such a small number. I mean, Africa has, like you said, 8.65 million cases, while UK has 9.8 million cases since COVID started. And the UK's population is just 66.2 million. Africa is 1.3 billion. So I guess some people will say it's the grace of God, or is something special about Africa we don't know. Is it the malaria we don't know? But really, we're just lucky to be where we are in Africa.
Let me bring in Imoesi, who's always said to the continent, skip this whole talk about luck, talk more about infrastructure. By now, I recall then you did say Africa should be working. As a scientist, you also suggested that Africa should be working to saying, how they can come up with their own vaccine. So let us in on what you think the continent should be doing at the moment vis-a-vis the vaccine hesitancy that is still very much around, even in Lagos.
I think what we should be doing is the basic research in Africa. So when I mean basic, the very basic standard research, not cutting edge, not state-of-the-art kind of research, just basic. So I'm going to cite an example. For instance, we have the Moderna in Nigeria, then we have the Oxford AstraZeneca, and we have the Johnson & Johnson vaccines in Nigeria. And I think it's been over 8 months now since when we had the Oxford AstraZeneca through the Serum Institute of India. My first, scientific background, we say that before you administer those vaccines in Nigeria, the first thing is to do a well-controlled study. And what I mean is, for instance, before you give the vaccine to A, B, C, and D individual, you're going to have a set of individual without vaccine administration. That will be your control, your normal control group. Then the experimental group is going to be people who are vaccinated with the first dose. And then you watch out for this individual over a period of time to see if, number one, these individuals do have immunogenicity. So if you administer this vaccine to Nigerians, for instance, are they producing the required antibody? That is a question you need to ask first. And in doing that, you simply do just normal antibody tests for IgG, IgM, which is really simple anyway. That's why I said basic research. Now, over time, you can tell if the number of persons who got their vaccine since the early days of, I think, April or March, if they still have a significant level of vaccine antibody that is able to combat the current variants we have in Nigeria. But so far, to the best of my knowledge, I'm not aware if there is any study started since March as regard to the vaccines. So when countries around the world, for instance, UK are saying, oh, the vaccines are waning and what have you, that piece of evidence is based on research. But in Nigeria, if you intend to deploy a third dose, for instance, you can't really go by that particular phenomenon because you have no evidence-based research to support if you do need the third dose. And finally, when you look at the way COVID-19 has played out in Africa, specifically in Nigeria, we know that it's really different. So it's more like a different pandemic in Africa and in Nigeria, looking at the way we barely adhere to the non-pharmaceutical intervention. So that what that tells you is that the COVID-19 virus, which is a SARS-CoV-2 virus, has less impact in the system of Africans. So if that is the case, we do know that the SARS-CoV-2 virus through the ACE receptor, the spike protein binds to the ACE receptor. And that is the same receptor the vaccines are targeting. So if people are not really coming down with this particular virus, it means that the virus is not really having a firm grip on these individuals. So will the vaccine have the same capacity to stimulate this individual to produce the required antibody immunity you're looking for? You need the basic research to answer that. It's really simple, but we are not seeing that right now at the moment. And finally, when you go through literature, for instance, you go on PubMed to search any form of research in Nigeria barely come up in any form of research. What you see are just normal literature reviews, commentary, later to editors and what have you. But when it comes to the standard basic research, there is nothing in the last 24 months.
Well, that's not too good a story. I come back to you, Dr. Adefolarin. You know, some researchers listening to your colleagues there, some researchers have also said that let's leave the populace to get infected and see how they can build their own, herd immunity. Is that the thinking already in the country or specifically in Lagos?
Okay, thank you very much. You might just quickly respond to what Dr. Imoesi said. Actually, there's quite a lot of research that we've done. I know in Lagos State, I think we've published about maybe close to 15 papers. I'm actually, I've made authors in some of them actually, really. So, yeah, I know you can't compare the volume of research here to what is going on outside the country, and a lot of it can be tied to funding. You need a lot of money to do research. You understand, which is not really forthcoming, but even with our constraints, we have actually been able to do a lot. I understand what he's saying about the antibody testing and all that, and actually there are some pending papers coming out on that from Lagos State here, where samples were taken before they were vaccinated, 2 weeks after, 3 months after, just to see whether they are mounting antibodies and whether the antibodies are sustained or not. But I mean, he knows better than I do. He's a researcher, so he knows the kind of issues we have in the research world when it comes to Africa publishing and all that. It's not that straightforward, but yeah, we are trying our best. But your research is important, and we're trying to do that. Now, as to what you're talking about allowing people to naturally get infected, developing natural immunity, well, I think events have passed that stage now. Okay. We were at that stage at the point in which there was no good preventive measure. You understand? So if you do that now intentionally, then that will be wrong. It will actually be unethical. It's not something you should do. At some point, we did have a vaccine. But now there's a proven vaccine that works, you understand? So then situations could occur maybe because of some issues, maybe natural disaster, or there's a war or something, some people couldn't get vaccinated. But you can't just, that was what happened with the Tuskegee experiment in the US, where there was a cure for syphilis, but because some researchers wanted to study the natural cause of syphilis, they denied them the cure, though the cure had been available for more than 20 years, penicillin. You understand? So denied them the cure, and then they allowed this disease to run its natural course so that they could study. That's so unethical. You do that, you could actually go to jail for that now. So yes, there are situations where, because of one constraint or the other, people may not be able to get vaccinated, but it's not an intentional strategy, not at all. The strategy of the Nigerian government and Lagos State government is to get as many people vaccinated as much as possible, and that's why there'll be a lot of plans. Recently, the Lagos State governor was able to bring in the private sector into the vaccination drive, you understand, because the aim is to vaccinate about 4 million people by Christmas, and but 135 facilities have actually been registered.
By Christmas?
Yes,
that's almost a month from today.
Yes, it's very ambitious, but that's why, when you aim for the moon, you get through the sky. So it's something we can do, because we have said we have the capacity to do that, especially as a state in Lagos. And what we're trying to do now is to bring in the private facilities, because we believe that people will readily go to them, and then we believe that because of their wide network, they could be closer to a lot of people. And so we believe that if they get involved in the vaccination exercise, which they have been doing, they give measles, they give polio vaccines, they give hepatitis vaccines made of this private facility. So we believe that if we put COVID on board, then we believe that we'll be able to reach more people.
Let's bring you, Dr. Abiye, quickly here, and it has to do with the role of primary health care on the continent, especially in a pandemic. How would you rate, that so far on the continent, knowing full well that that's your area of forte? Are we doing enough?
We're not doing anything that is commendable. Having practiced in Nigeria for many years before I came to the UK, the NHS, even though we talk a lot about it, that it's not doing well, but compared to what we have in primary care here in the UK, where health services provide to people based on need, free of charge, based on need. When you look at that and you compare it to what is available in primary care in the continent or in our country, Nigeria, we are not doing well at all. At least going back to the time of late Professor Dikwe Ransom Kuti, when primary healthcare in Nigeria was well recommended worldwide, we're not doing well at all. So basic infrastructure, basic services, support for staff, payment of salary, the basic thing is not, we're not doing well. And that's one of the big problems we have in Nigeria is the fact of governance, having visionary leaders, people who are transparent, who are honest, using the available resources to provide services to our people is just not there. Unfortunately, the story of poor man, they suffer, monkey, they walk, baboon, they chop, has been there in Nigeria, has not changed much. So primary health care could do so much more in Nigeria if it is well-funded, well-supported, well-supervised.
Dr. Imoesi, these are some of the stories that honestly look like counting against the continent. At the moment, I'm quite sure you must have heard stories of some countries not accepting COVID-19 passports from Africa. So if you look at some of the key things we've highlighted here, is it safe to say this is more like a proof that the rest of the world doesn't trust the leadership on the continent?
Well, I don't know whether I can sidestep the question a bit, but going back historically, Africans were taken away as slaves, and then our raw materials are taken away, and then the finished products are brought back to us at much higher costs. We have the brain drain of people like us, and then we have loans bringing new colonization to Africa. Africa manufactures less than 1% of all the vaccines, not just COVID. Every vaccine that we use in Africa, we manufacture less than 1%. And those are the real critical issues that we need to address in Africa, to put the right people in the right places who have vision to look at what do we need to do differently for the next 10, 20 years. Where we have wars, conflicts, civil unrest, in our country and elsewhere. Those are the basic bread and butter stuff which do not exist in Africa. And where you don't have institutions that work, where you don't have governance that works, it's very difficult to expect things like COVID vaccines to work. We can't perpetually depend on the outside world to supply us with the things we need, and then we expect things like this to work. We're just lucky, I say again, that how can an entire continent have less infection than a small country like United Kingdom? So really, if we need to make a difference, and we have the people within Nigeria in those institutions who need to be supported. The researchers are there. If a research institution is poorly funded, then there can be no worthy research coming out of that institution. We need lab facilities even to do SARS-CoV-2 testing. You hear about people who are getting certificates to travel abroad without being tested. So all those are real issues we have in Africa and in our country, Nigeria. And unless there's a transformation of public service, a kind of real transparent relationship between the public sector and the private sector to do things together. Where are the billionaires of Africa? Why are they not investing in COVID research? Why are they not setting up lab facilities for testing in Africa with all the funds they have at their disposal? I think these are the kind of things that we need to look at to try and make a difference for the future. Even the 0.3 mils auto decibel syringes, there is a shortfall in the world. Why can't people invest in it and produce them within Africa? So local production of, even if it's not the vaccines, of the disposables for the vaccine program, even if we can do that, is one step forward. But this whole dependence on COVAX, on bilateral donations and all of that is not good for Africa at all.
Let's bring in Dr. Imoesi here. I'll throw you a double, Peter. And first, I want you to react to the same question I posed to Dr. Abiye. Initially, I was actually meant to give that to you. But I also want you to also let us in on the importance of research. Why is Africa not doing enough? Listening to Adefolarin, he's also said something in that aspect. Yes, there seems to be some amount of research, but it's not enough. And if you still have not been, as a researcher, have not been able to, pick, off your radar, has not been able to pick Africa, in terms of research on what we're talking about, COVID-19, then it would seem as if there's actually nothing being done. Peter?
First, when it comes to research, what you really need is expertise and training with the right set of skills. That is the first thing. That is the bedrock of research. Once you have a set of skills and you're well trained, then you can go ahead to talk about funding. So first, in Nigeria, what is the capacity of training when it comes to the level of PhDs? So when it comes to PhDs in Nigeria, what is their capacity in terms of laboratory-based research? That is one. Then two, when it comes to funding, what is the funding like in Nigeria? Three, when it comes to research and development, R&D companies, how many do you have in Nigeria? So I'm going to give you a very simple example, and Dr. Folari can attest to this as well. When it comes to the simple reagents you need for your RT-qPCR, which is a primer, I'm not sure there is any R&D company in Nigeria that is able to produce primer, for instance, for the SARS-CoV-2 testing, for instance. I don't know. But in the early days of this particular pandemic, we're actually waiting to get primers from abroad. We're waiting to get RNA extraction kits from abroad. Whereas these are the sort of reagent and component that you can readily produce within your country. So if some of these reagents that you need when it comes to research, you need to store them at times, you need to store them in -20, that is ice freezing temperature. And when these things are delivered into our own laboratory here, they come in at -20 level. So if you're trying to get the same reagent to Nigeria, for instance, what would be the flight duration? Do you have the capacity to store that? So when it comes to research, we're not really grounded in that area. Secondly, I lectured in Nigeria for 2 years, so I understand the game and the gimmicks when it comes to research in Nigerian institutions. Like, I know it very well. When you pick up a research paper in Nigeria and you check the journal that paper is published, many a times it's just barely 0.02 impact factor, if there is even impact factor to start with. That is the level of research you see. And the quality of your research determines the level of journal you aim at. My first publication I did at the end of my PhD, I published that first paper at 5.8 impact factor. My second paper that came out in joint collaboration with NHS here hit about 8 point something impact factor, which is the Cochrane. Then my next paper in view right now, we are targeting 7.8 impact factor. And this is based on quality research that is evidence-based. Like I said initially, when I was talking about the research in Nigeria and how you can test for COVID antibodies and what have you, it's 8 months already. So already we know that these vaccines, they have a short duration of about 6 months or more. So if you're saying that you've taken your samples far back in April, May, or June, or wherever, by now you should have this piece of information coming into the mainstream, people having access to this information for independent researchers, independent bodies to be able to analyze this piece of information to know exactly what is going on within your country. Like I've said repeatedly on this platform, I've said that because of the non-adherence to the non-pharmaceutical intervention in Nigeria, well, let's say barely minimum, let's say adherence to the non-pharmaceutical interventions, you may be surprised that the continuous exposure of Nigerians may likely have led to the fact that many Nigerians are already exposed. And once you are exposed repeatedly, you're going to be having this antibody going around in your population. And over time, we also know that the population of your country is somewhere around 22 point something when it comes to the average median age of Nigerians anyway. Whereas in the UK, our own average median age is somewhere around 50 to 55 of age. So you have more of older people in this part of the world. And of course, COVID tints towards the older population and people with comorbidities and people who are more vulnerable to the disease. Whereas in Africa, for instance, you have the young age demography. And of course, the COVID is actually far away from those set of individuals. But all of these pockets of issues can actually be addressed by someone who can really sit down to design a research carefully. It's not about the funding alone. It's not about the capacity alone. It's about the ability to look into the issues and design a research that is able to answer those issues. So I think we need to go back to the drawing board to train our scientists effectively to be able to answer solutions and problems that do have solutions within our own domain and not depend on the outside world. Right now, we're talking about the third dose. What evidence do you have for a third dose in Nigeria or in Africa? There's none, for instance, in Nigeria, but you are going about your third dose. You're talking about the fourth wave, for instance. I saw the data today from the NCDC. Lagos had reported about 30 cases. Now, when you look into this data, what is the testing rate in Nigeria? You'll be surprised that our testing rate has dropped significantly. And that has been the case over the last couple of months, this kind of yo-yo kind of testing. And when you have this kind of testing that is up, down, like a arithmetic graph, what you have is you can't really do anything with this information. You can't say you're in the first wave, you're in the second wave, or you're in the third wave, because in the first wave, we were testing about 100,000. Within that particular first wave, you came down to 1,000 per day. Then the next day, you tested about 5,000. So just like that, you can't tell where you are effectively. Here in the UK, you have the rapid lateral flow test kit. I've used about 5 of this in the last couple of months. This is really cheap. And Nigerians have access to this really cheap test kits in Nigeria? The answer is no. But you have a lot of funding coming through the Western community into the country. You have support people bringing in money to the country. But we're not really seeing the impact of this money within your own population. Rather, you're depending on COVAX for your vaccines, whereas other countries are going out there to procure their own vaccine and vaccinate their own people. So it's really a complex issue that we cannot really unfold in this particular platform we're in at the moment.
Well, no doubt we can't, get all of this off the plate, but again, we'll stay on the matter. Well, we'll come back, as you rightly put it, we'll be talking about solutions to some of the key things and how the continent can avert a fourth wave. Well, in Africa, Egypt has had the new highest rate of infections, followed by South Africa and Libya. These countries are yet to vaccinate half of their populations like most African countries, but are still recording high rates of infections by African standard. Africans don't wear masks again and are not getting jabbed yet. The virus seems to be slowing down. Or are Africans coming down, getting infected, and recovering asymptomatically? These are some of the key questions that now experts will help us answer. I still have with me here in the studios Dr. Adefolarin, and of course joining me in the UK, Dr. Abiye, Hector-Goma, and in Aberdeen, Dr. Peter Imoesi. Let's start with Adefolarin here. Quickly, I was going to ask you about the vaccine passport. I threw that, at Abiye a while ago. A lot of people were confused, having had both, or let me use the word, complete jabs, which is like 2 going out. Some of them were actually told that they don't accept this. So has the government worked on that?
Yes. That was a serious problem initially about 3-4 months ago. Because I had a couple of cases of people who left here, went to the US, and they were told that they have to get the vaccines again. They have to get Pfizer and all that, So there were issues because most of the vaccines we got here were from India. They were made in India, but they were AstraZeneca. It was the same company. So when those issues came up, yes, there was a lot of outcry at high levels. These things were discussed. And now, as I speak, we have more acceptance of our vaccines. So with the Nigerian vaccine passport, fully vaccinated, you get the same pass and the same relaxation of restrictions like colleagues from anywhere in the world. So we have actually worked on that. That was a problem at some point, but now and it's actually helped to increase the vaccine drive. because a lot of people now see that, look, there's a clear difference between those who have been vaccinated and those who haven't. If I have these privileges, then I'd rather vaccinate. So that's a problem, but it has been sorted.
Well, let me bring in this quickly here, because we're trying to see how we can slow this down. Worship centers, parties. This is Lagos, and Lagos is known also for parties.
Yeah.
And a lot of Nigerians or Africans love worship. All of a sudden, these centers or places have remained open, and we have also seen many people still, going about without their mask. Is this going to be a problem for us as we go towards the Christmas and New Year celebrations?
Well, I mean, difficult to say. I mean, common sense agrees that maybe, we should tone things down a bit and all that. But one thing we've seen with COVID is that our situations may not actually be the same, and we have to be careful of following what others are doing. Like Sika, Fisherman, and both. We can't just swallow everything they give us from outside the country. You understand? In as so much as they are quote unquote advanced. When it comes to COVID, we beat many countries. Nigeria was rated by WHO as the fourth best responder to COVID in the world. That means we may have gotten something else, whether by luck or whatever. At least we got some of our acts together. So the challenge is that, yes, some countries, when you look at a lot of the countries in the world, in the UK, in Austria, Germany, many of them have had protests against lockdown. In France, many so-called more developed countries, because it's not easy, and these are people that have bailouts, they have all sorts of subsidies and stipends. We can't do that here. So this Christmas you're talking about, that is when some people make enough money to see them through the next year. So if you say that, okay, yeah, you want to cancel everything, it's really going to work. When COVID started, we locked it down everywhere. Airlines, everything came to a halt. Now, despite the fact that some countries are recording similar number of cases this year and last year, nobody has gone to that form of lockdown again, maybe with the exception of very few countries, because everybody is trying to see how can we move on despite this. And that's what we're looking at here in Lagos State. You understand? Say, okay, fine, we have this problem. Okay, there are some things we can cancel, like the festival, the party that was cancelled, right? Yeah, we can do that. But there's some other things that we can use our common sense, find a way to mitigate it. You understand? COVID is like Thanos, from Avengers. Somehow, so far, it's shown as a bit inevitable. You understand? So, but then how can we reduce it? How can we prepare for it? How can we mitigate the destruction that's supposed to cause? Because remember that also, if you take away people's livelihood, you understand, you're also, that they could actually die faster. That's the truth, So we have not had, COVID hasn't affected us as much as it affected people in other parts of the world. So why should we really lock down our economy and suffer all those things? So can we find a way to balance? That's what we're trying to do here.
Well, Dr. Abiye, help us here. And it has to do with what the continent is dealing with. For instance, in a state like Lagos, looking at some of the worst affected people, and all of a sudden things seem to be improving. Let us in on some of the key things people should know about a pandemic, because sometimes they say as you try as much as possible to understand it, if you're not careful, when you let down your guard, you'll be in bigger trouble.
Yes, it is known that in a pandemic, if a vaccine is the holy grail to putting the pandemic behind the population. So having the COVID vaccine is actually our best bet in terms of the pandemic where we are. At the same time, we need to also be aware, or to remind ourselves that the infection rate in Africa is far less than what's happening in other parts of the world. So we don't necessarily have to do what UK, Europe, or US is doing. The other issue is that we have other priorities. There is poverty in the land, there is malaria, tuberculosis, diarrheal disease of childhood, childhood immunization, malnutrition. All those are things that are competing for the same resources. So for policymakers, it's not easy at all. But I would think that the basic things about, maintaining some space, sanitizing and wearing a mask, and insisting that worship should go on, parties should go on, but making, kind of legislation about numbers of people to attend events. I think that's something that needs to be encouraged. The other thing that could be done perhaps is maybe if, for example, you're an event center or you're a mega church, then maybe all officers of the church should have lateral flow tests. And then we can use the results of the lateral flow tests of the leadership or the core members of an organization to determine what to do. Because if, for example, there are 50 officers in one church and they do lateral flow tests every week, and we find out that many people are having positive tests, that means that they can make a decision to reduce or stop, activities in that place. Maybe that kind of local approaches, but with the level of infections that we have, I don't think a blanket stoppage of Christmas activities across Africa, across Nigeria, is something that I will encourage, really.
Well, Dr. Peter, this is not a put-down question to any country, but again, looking at what has come in from India, can't Africa get its own vaccine across the continent and even gift others its own vaccine?
So I think for the COVID-19 vaccine, we should just depend on already available vaccines already, because developing a vaccine is not really, let's say, something you do overnight. So what I will really advise is, going forward, we could set up mechanisms, like we set up platforms where we can produce our own vaccines in the nearest future. But with the COVID-19 vaccines now, I think we've got enough already. We've got Pfizer, we've got Moderna, we've got Oxford AstraZeneca, you've got the one Covaxin from India, you've got the Oxford AstraZeneca from India as well. You've got Novavax, you've got Johnson & Johnson, you've got Sputnik V, you've got a lot of vaccines already. So there's no point racing for new vaccines anymore. So that's just my own advice. But what we really need to do is we need to sit tight and put our house in order to ensure that when it comes to the research, we have the best brains at strategic positions. We do have best brains around the world when it comes to Africa, when it comes to Nigeria. The only problem we have is the ability to harness these individuals and bring them on board for them to create the magic we're looking for in Africa and in Nigeria. And that speaks to leadership as well. So I'm going to speak to what we have at the Nigerian High Commission here in the UK. So in August, I was at the High Commission, and the head of the High Commission went to the Home Office, that is the UK Home Office, for a meeting. When they got to the Home Office, they did a lateral flow test. The lateral flow test is just about 15-minute test within your house. Like I can do it while we're in this particular interview right now. So they did that particular test, and they were able to identify about, I think, 2 officers, Nigerian officers, who were COVID positive. So the lateral flow test is not so sensitive, but yet it was able to confirm these individuals that they had COVID, and the whole Nigerian High Commission was shut down for about 10 days. Now, what you can say to that is leadership. So if I were the High Commissioner, for instance, in the UK, I'm the Nigerian High Commissioner, for instance, I would say, before my workers come in on daily basis, you need to show me a test you've done a night before. So every day you come in, you do a test. So for instance, you're done for work 5 p.m. today. When you get home, you do a test at 9 p.m. and you're going to get a text message. When you come the next day, you show me the text message that, oh, I'm negative, or if you're positive, you stay at home. So this sort of leadership is playing around everywhere when it comes to Nigeria, when it comes to Africa, and when it comes to the way we do things in Africa or in Nigeria. So we really need to get our leadership right to ensure that every other thing fall into place. And that also speaks to research as well, speaks to R&D, speaks to funding. What's our priority? Is research our priority in Nigeria? Is research our priority in Africa? Like I said on the same platform, research is a new oil well in the 21st century. Get it right, you get the employment you're looking for your people.
Before I let you go, Dr. Imoesi, is there a vaccine that is made in Africa? Just wondering, thinking if the disease, the ailment, the pandemic, if it's prevalent in some of these, countries, one would have thought that the experts who will be maybe first to actually knock off a vaccine, for instance, malaria.
When it comes to COVID, I know we do have some African countries with candidate vaccines. For instance, Nigeria, recently there's a candidate vaccine for COVID. That's all we know. Now, when you say you have a candidate vaccine, it doesn't mean that it's going to go through the ranks of preclinical trials, phase 1, phase 2, and phase 3. So it's not enough to have a candidate vaccine. That is one. Then 2, when it comes to clinical trials, is really, really expensive. So I'm not really aware if the government are willing to fund this kind of research. And also you need some basic laboratories to be able to carry out some standard research according to world international best practices. So do we have these facilities in Nigeria? I'm not so sure about that. But when it comes to South Africa, I do know that South Africa are really doing well since the beginning of this particular pandemic. South Africa are doing very well. Kenya are doing a bit well as well. Rwanda are also doing very well as well, and a pocket of other African countries, specifically those in the northern part of Africa. So they're also doing very well as well. But when it comes to research, I think South Africa are really doing very well when it comes to research as regards to COVID-19. And also, I think there is a kind of agreement right now between a particular company in the Western world with the South African, research institutes to actually do the fill and finish when it comes to the COVID-19 vaccines. That is the best I know when it comes to COVID-19 vaccine development on the continent.
I would want to take this to Dr. Folarin. Let me take it to Abiye. And it has to do with government. Listening to Peter, he said something, if the government is willing to fund it. What comes to mind quickly here is how much value we have been able, we here, Africans, have been able to place in the life of an African. Shouldn't this be a thing to be on the front burner for every African nation? Dr. Abiye.
I mean, that's a very good question. Thank you very much. About an hour ago, I actually went online to check I Googled African billionaires, and I saw a few names all over Africa. And my thought was, is this not something that is the market? I mean, I'm not talking about any public service, but research into vaccines is a big market that African billionaires can look into. And somebody said online again that we should be looking at a pan-coronavirus vaccine, because we've had a SARS, MERS, now COVID, that the coronavirus problem will never go away. So maybe people can put money into research around a pan-coronavirus vaccine for the future. And I mean, like we've said here, Africa has fantastic, brilliant experts all over the world. And perhaps somebody or a group of people can get a database of who is who in Africa and all the research centers across the globe, and perhaps bring them together and begin to look at the next 10, 20 years, yellow fever, COVID, whatever it is. How can we as Africans begin to solve African problems? I mean, I feel it brings tears to my eyes that we are still depending on foreigners to solve our problems. I think it was late Ojukwu that once said that we have to get the foreign, they were doing pounded yam in 1004 flats. It was a white man that bought yam pounder for us. We need to begin to look at research that solves problems, not to have papers and research that doesn't solve problems. It's about time. Of course, a lot of Africans are into tech, femtech, medtech, health tech, and all of that. A lot of people are doing things across the globe. Perhaps some billionaires should gather these people, let them invest in this for the future to begin to solve problems of Africa and not depend on foreigners to do things for us.
Let me bring this to you, Dr. Folarin, and it has to do with the government saying it would enforce a no vaccine, no entry rule, especially as we move into December. Will this help? Because there's still the argument that you can't actually force people to present themselves for this vaccine.
I mean, it depends really, but if I could quickly just address the issue of research and all that. Look, I am not somebody who doesn't deceive himself on the state of the country, you understand? But at the same time, it's not all doom and gloom. Yesterday, we were at the meeting with the Federal Minister of Health, you understand, why we're going to try to start the Solidarity Plus trials, which is an WHO sponsored trial looking at medications for COVID. And we're trying to try out imatinib, antimalarials, and some other drugs, you understand. We're supposed to get the first delivery of the drugs to the study sites all over the country. That was just yesterday, you understand. NIMR, that's the Nigerian Institute of Medical Research in Yaba, is actually working on getting vaccines done. And one thing we've learned with COVID is that you keep checking, because even if you may find something that's even better than anything that is existing now, like Imoesi said, the current vaccines seem to wane after 6 months. Who says that the next one to be discovered maybe here would last forever? We don't know. So yeah, things are not as bad. I understand. There's always this feeling when people travel sometimes. Yes, I understand the issues, and I'm not somebody to shy away from them. But we are doing the best with the limited resources that we have, to be sincere. That's the reality of the situation.
But you would agree you're being stretched.
Everybody has been stretched. Everybody has been stretched. I've been on the front line in COVID since COVID started, from the first case in this country. I took part in Ebola, I took part in Lassa. I've been in every outbreak in Lagos State. Everybody has been stretched. And some of us are even far better than what's going on outside the country in terms of being stretched, you understand? Everybody has been stretched, mentally, physically, financially, always stretched in ways we've never done before. Many of us have suffered of COVID. I've had COVID more than once. Okay, so but the reality is that despite all those problems, we've actually been able to soldier on, and I think we've actually done well. All being said. Now, of course, there's a lot of room for improvement. I agree with you. All these problems with research and all that, absolutely I agree. But then we are still trying. I mean, there are sprouts, there are shoots coming out of the ground. I would believe that if we work on these things, we are going to get there. Hopefully we'll get there. That's what keeps us going. Now, when you talk about vaccine mandates, yes, it's quite controversial. I mean, we see the highly politicized vaccine mandates in the US, for example, where a lot of states are going up and down over it, carrying themselves to the Supreme Court and all that. Yes, I know, but what we also know that to an extent, if you don't make some of this things compulsory, some people will never comply. So what we're trying, I believe what the Nigerian government is trying to do is first to make the vaccines available. Now, once the vaccines are available, then they cannot come and say, okay, fine, look, you must get the vaccine somehow, because if you do that, it will help us to really, it will protect you, it will protect not only you, it will protect people around you, and it will help us to reach goal faster, you understand? But that's what they are trying to do. They are buying, they are begging, they are negotiating, doing whatever they can to make the vaccines available, because I mean, I've been in quite a few meetings where we actually cautioned against the vaccine mandate when we didn't have enough vaccines. Because what will happen when that happens is that people go to the black market. And then there will also be all sorts of fake vaccine cards here and there, because the vaccines are not available, so people are going to do that. So what I believe the Nigerian government is trying to do now is we have enough vaccines. Okay, if we have enough vaccines, please try and get vaccinated. But really, vaccine mandate has not really been stressed here. There was a report purportedly that came out from the ministry that by 1st of December, they are going to mandate every federal worker to get one, but that has been squashed. We have not gotten there yet. Maybe we'll get there, I don't know.
Well, it's a fine place for us to leave it today. As Peter Imoesi did say, we haven't actually scratched the surface. I'm hoping that we can keep this conversation going. We should have all three of you again. I just hope that we'll have the time to talk more on, putting in place, going beyond vaccination, putting in place better infrastructure for health on the continent is very key. But for now, vaccination is still low in Africa, and there are no inspiring moves that promise this will get better. Take your COVID vaccines or mask up and protect yourself. Many thanks for being in such nice company, Dr. Peter Imoesi, and of course, Dr. Adefolarin and Dr. Abiye. Many thanks, gentlemen. See you again. Bye-bye.